Welcome to Tocilizumab Chronicles Beyond the Cytokine Storm, where we explore the intricacies of tocilizumab and its role in medicine. I'm your host, Dr. Shikha Agrawal, and we have here Prachi Virat, our microbiology expertise with a passion for microbiome and bioinformatics. Welcome to the show, Prachi. Let's unfold today's episode beyond rheumatoid arthritis in context of tocilizumab's expanding role in medicine.
Thank you, Dr. Shikha. Excited to talk about this with you and your listeners.
Let's shift gears and talk about tocilizumab's use in conditions beyond rheumatoid arthritis. Can you tell us about its role in treating giant cell arthritis?
Great question, and yes, tocilizumab has made significant inroad beyond RA. Giant arteritis, or GCA, is a type of vasculitis affecting large and medium-sized arteries, often presenting with headaches, jaw claudication, and vision problems. Traditionally, it's treated with high-dose corticosteroids, but long-term steroid use come with serious side effects. Tocilizumab was approved by GCA after GiACTA trial in 2017, which showed that adding weekly subcutaneous tocilizumab significantly improved sustained remission rate and reduced steroid dependency. It was a game changer because it not only controlled disease activity but also helped patients avoid complication of prolonged steroid use.
That's fascinating. What about systemic juvenile idiopathic arthritis? How does tocilizumab fit into treatment plans for this condition?
Absolutely. So, systemic juvenile idiopathic arthritis (SJIA) is a severe form of childhood arthritis marked by systemic inflammation, daily fevers, rash, and arthritis. IL-6 play a central role in its pathogenesis. Tocilizumab has proven highly effective for SJIA, particularly in children who don't respond well to conventional therapies like NSAIDs and steroids. It's used either alone or in combination with other medication, helping control both systemic symptoms and joint inflammation. Studies like the TENDER trial demonstrated substantial improvement in clinical symptoms and quality of life for these young patients.
Are there any other conditions where tocilizumab is being explored or used?
Yes, tocilizumab is being actively studied in several other inflammatory and immune mediated conditions. These include cytokine release syndrome (CRS), especially associated with CAR T cell therapy in oncology. When it's FDA approved for severe CRS, it's also being investigated in Castleman disease, lupus, and neuromyelitis optica. And more recently, we have seen in severe COVID-19 pneumonia to manage hyperinflammation. And researchers are even exploring its potential in certain cardiovascular conditions and long COVID syndromes where IL-6 may contribute to persistent inflammation.
Well, what do you think is driving the interest in tocilizumab's use in these conditions?
Excellent question. It boils down to IL-6 broad role in as a key pro-inflammatory cytokine involved in variety of disease pathways. As our understanding of immunological pathway evolve, we are realizing that IL-6 contribute to the inflammatory cascade in numerous conditions, not just classic autoimmune disease but also in oncology, infectious disease, and even certain neuroinflammatory disorders. Tocilizumab's well-established safety profile and versatility as both an intravenous and subcutaneous therapy make it prime candidate for repurposing and clinical trial in diverse areas.
What are some of the benefits and challenges of using tocilizumab in these conditions?
Great wrap up question. The main benefits include targeted immunosuppression with fewer broad immune effect compared to steroids, better control of disease specific inflammation, and steroid sparing potential. However, the challenges involve managing infection risk, monitoring the liver enzyme elevations, high cost, and limited long term data in newer indications like COVID 19 or neuroinflammatory diseases. Additionally, logistical issues like the need for IV infusion in acute settings and regular injections for chronic disease can be barrier for some patients.
Before we close, Prachi, what's the one message you would want our listeners to take away about tocilizumab's role beyond rheumatoid arthritis?
I would say the big takeaway is this: Tocilizumab is no longer just an arthritis drug. It's an evolving tool in a broader landscape of immunology and inflammation management, with exciting possibilities still emerging.
Well, Prachi, it's been enlightening having you on the show. Your expertise has provided valuable insights into tocilizumab's expanding role in medicine.
Thanks again, Dr. Shikha. It's been a blast.
And with that, we wrap up. Thanks for listening. Stay curious and don't forget to subscribe and share.